babies. Breastfeeding during subsequent pregnancy. You may unexpectedly fall pregnant while your first baby is still young and nursing, even if your periods have not returned. No worries. It is not a risk to either the breastfeeding child or the development of the new baby. Some mothers choose to reduce breastfeeding if they have growing bellies that make breastfeeding uncomfortable, nipple soreness, or nausea. Also, some babies may start to wean themselves on their own as breast milk begins to change taste in preparation for colostrum for the new baby. You will need additional nutritious food and drink in order to keep up your energy. Remember, you will be nursing and growing a baby at the same time. Your doctor may advise you to wean if you experience uterine pain or bleeding, a history of preterm labor, problems gaining weight during pregnancy, or excessive cramping due to nipple stimulation.
Many mothers who get pregnant while still nursing a baby wonder if they can continue nursing, and the answer is yes, depending on your circumstances. You have to remember that nursing a baby and growing a baby both take extra energy, so be sure you're thinking about your energy requirements. You're drinking enough, you're eating enough to meet the needs of you, your growing baby, and your nursing baby. Many mothers notice that their milk supply diminishes a little bit during the first few months of pregnancy, and while you're pregnant, the taste of your breast milk can actually change too. So both of these things in most cases will cause babies to naturally wean themselves that are nursing. But if it doesn't, it's okay to continue nursing through your pregnancy as long as you're not having complications. Women, when they're pregnant, often experience breast tenderness, and so nursing another baby can add extra discomfort. And if that's the case and you feel the desire to stop, then that's okay. Also, some women have issues with preterm labor, and the nipple stimulation from nursing a baby can contribute to preterm labor. And so your doctor may recommend that you stop nursing if you're having issues with this. But if you don't have any complications and you're not overly uncomfortable when you nurse, and you feel that your needs are being met, the needs of your nursing baby and growing baby are being met, then it's okay to continue nursing. If you have any other questions for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too. Many mothers who
Feed the newborn first to ensure the infant gets the colostrum. Milk production will increase a few days after birth. Ask your partner or friend to take care of one child while you breastfeed the other. Mom will need more fluids, healthy foods, and plenty of rest. Breastfeeding after breast surgery. Women who have had incisions around or across the areola are more likely to have problems making milk. If you ever had surgery on your breasts for any reason, talk with a lactation consultant. If you are planning breast surgery and still want to breastfeed in the future, talk with your surgeon and request that he or she preserve as much breast tissue and milk ducts as possible. Now we'll talk about cleft palate and cleft lip. Cleft lip and cleft palate are birth defects that occur when a baby's lip or mouth do not form properly during pregnancy. A cleft lip happens if the tissue that makes up the lip does not join completely before birth. A cleft palate happens if the tissue that makes up the roof of the mouth does not join together completely during pregnancy. Surgery to repair a cleft lip and/or palate usually occurs in the first few months of life and is recommended within the first 12 months of life. If your baby has a cleft palate or lip, breast milk is still the best option for your baby's health. Use your thumb or breast to fill the opening left by the cleft to form a seal around the breast. You can express your milk to keep up supply. Some babies will have to be fed via a tube temporarily. You can always feed your baby breast milk by dropper or syringe. And you can also use a mouthpiece called an arbitrator that can be used to fit your baby's cleft. Let's talk about adoption and inducing lactation.
Hi, I'm Dr. Manisha Gogri, a lactation consultant and a medical doctor, and I'm here celebrating the World Breastfeeding Week with Baby Chakra. Do you know that mothers who are adopting babies or mothers who are having babies via surrogacy can also breastfeed? And there are some mothers who have unfortunately stopped breastfeeding due to medical reasons or due to lack of support. Even if it has been several weeks to months, these mothers can start breastfeeding once again. This is possible via the process of relactation and induced lactation. So let me tell you about relactation. There are so many mothers who did not get the right kind of guidance and help and therefore had to stop breastfeeding their babies but now want to start once again. So, via the process of relactation, this is possible. There are two main aspects. One is to get back the milk supply, and the other is to get the baby back to breast. Getting back the milk supply is possible by using certain medicines, herbs, and more importantly, lots of skin to skin contact with the baby. The more difficult part is getting the baby back to breast. The babies are often used to bottles, nipple shields, and pacifiers. We need to get rid of those and start feeding the baby using a cup or something like a paladai and get rid of the bottle. This helps us to change the baby's sucking pattern. Also, there is something called at-breast supplementation. There are lactation aids such as these, which could be the better alternatives to bottles because these help us to feed the baby directly at the breast. An important part of increasing the milk supply is also to start expressing milk. So the expression can be done using a hand or better a double-sided hospital-grade pump which helps us to bring in the supply faster. Using both these techniques, getting the baby to breast and getting in the milk supply, gradually the need for supplementation increases and most of these mothers are able to go on to almost exclusive breastfeeding. Let us now discuss induced lactation. These are mothers who have never breastfed. So their body has never prepared for breastfeeding. We start by creating a pregnancy-like state, typically using hormones, herbs, medicines, and pumping. We need a time of at least 6 months to complete the entire process. But even if that is not available, we can work with shorter protocols. Many of the mothers are not able to reach full supply, but that is not exactly the aim. Breastfeeding is more about bonding with your baby. It's not only about breast milk, and that is something which is so precious and valuable. That can definitely be achieved through this process. So, once the medicines are started, it causes breast development and some milk starts getting produced. About 6 to 8 weeks before the baby is due to arrive, we stop the hormones and continue with expressing milk using a double hospital grade pump, which gives us the best results. Once the baby arrives, the baby immediately initiates breastfeeding just like any other normal child. So in case of adopted babies who are older and who have initially been bottle fed, just like in the process of relactation, we can start with skin to skin and at breast supplementation. The more the baby suckles at the breast, more milk the mother produces. And that is how her supply is going to increase. Mothers are often happy even if they don't reach full supply because all the feeding is happening at the breast without a bottle and using supplementers. So, through the process of induced lactation, mothers who have not given birth can also thus breastfeed their baby. Thank you so much for watching. If you like this video, please click on the thumbs up. And for further such interesting videos, subscribe to Baby Chakra. Thank you.
So, Mothers who adopt can successfully breastfeed their babies. Lactation is a hormonal response to a physical action. The stimulation of the baby nursing causes the body to see a need for and produce milk. The more the baby nurses, the more a woman's body will produce that milk. Some mothers may need to supplement their own breast milk with donated breast milk or milk from a bank or infant formula. If you are adopting and want to breastfeed, talk with your doctor and a lactation consultant. You can prepare by pumping every 3 hours daily during the 2 to 3 weeks before your baby arrives. A supplemental nursing system or a lactation aid can help ensure that your infant gets enough nutrition and that your breasts are stimulated to produce milk. Using milk from donor banks. Donor milk provides the same precious nutrition and disease fighting properties. If your baby is born premature or has other health problems, he or she may need donated milk for survival. Other reasons your baby may also need donated milk is because he or she can't tolerate or isn't thriving on formula or has severe allergies. Never feed your baby breast milk you get directly from another woman or through the internet. A human milk bank can dispense donor milk to you through a prescription, and there are many steps that are taken to ensure the milk that you receive is safe. Call your insurance company or ask your doctor to find out if your insurance will cover the cost of donor milk. If your insurance does not cover the cost, milk banks can and will establish later payment plans, provide insight on how to get help with the payments, and a milk bank will never deny donor milk to a baby in need if it has the supply. Human Milk Banking Association of North America. HMBNA promotes, protects, and supports donor milk banking. They are the only professional membership association for milk banks in Canada, Mexico, and the United States. They set the standards and guidelines for donor milk banking for those areas. You can also contact HMBANA if you would like to donate some of your breast milk. Thank you.